The wedding invitation arrived on the same day as my cancer diagnosis. Cream cardstock with rose gold lettering. You are cordially invited to the marriage of Jessica Anne Torres to Michael James Chen. My sister's perfect day. 6 months away. June 15th. The same day as my third scheduled chemotherapy infusion. We can't change the date, Mom said when I called to tell her about the diagnosis. Not congratulations on Jessica's engagement. Not are you okay? Just immediate defense of the wedding timeline. Do you know how hard it was to book the Belmont Estate? Jessica's been planning this for months. Mom, I have ovarian cancer. Stage 3. I'm starting chemo next week. Silence. Then, well, chemo is every few weeks, right? Can't you just skip one? Or reschedule it? I was 31 years old, a civil engineer, and I'd just been told I had a 40% 5-year survival rate. But Mom wanted to know if I could reschedule my cancer treatment around my sister's wedding. It doesn't work that way, I said quietly. I'm sure your doctor will understand. This is Jessica's wedding, Natalie. Her one special day. You can't miss it because of some medical appointments. Some medical appointments. 6 rounds of carboplatin and paclitaxel. Surgery to remove tumors. Radiation if the chemo didn't work. Hair loss, nausea, immune suppression, and a 60% chance of dying within 5 years. But Jessica needed her maid of honor. Over the next months, the dismissals continued. When I lost my hair, Mom suggested I was being dramatic about wearing a wig to family dinners. When I was hospitalized for neutropenic fever after my second round, Jessica complained I was making everything about me by being sick during her bridal shower. When I tried to explain I might not have the energy to stand through a full ceremony, Dad told me to toughen up because people deal with worse every day. My younger brother Ryan was the only one who seemed to understand. This is insane, he said after a family dinner where Mom had spent 2 hours discussing centerpieces while I'd sat silently, fighting nausea from that morning's infusion. You have cancer. They're treating you like you have a cold. Jessica's wedding is important to them, I said. You're dying, Nat. That should be more important. But it wasn't. The wedding consumed everything. Mom took a leave from her nursing position at Valley Hospital to help plan. Dad, a hospital administrator at the same facility, coordinated vendor payments. Jessica quit her marketing job to focus on being a bride. The house became a staging ground for floral arrangements, seating charts, and dress fittings. My oncologist, Dr. Sarah Reeves, noticed the strain. How's your support system? She asked during my pre-chemo appointment for round 3. Fine, I lied. Natalie. She set down her tablet. You've lost 12 pounds since last month. You're not sleeping. Your anxiety scores are elevated. What's really happening? I told her. About the wedding scheduled on my chemo day. About being called dramatic for being sick. About Jessica's fury when I'd suggested doing a simple courthouse ceremony so I could attend without compromising treatment. Dr. Reeves's expression went very still. Your mother is a nurse? At Valley Hospital. 25 years. And she's asking you to skip chemotherapy for a wedding. She says it's just one session. That it won't make a difference. It will absolutely make a difference. Dr. Reeves pulled up my treatment plan. You have high-grade serous carcinoma. Missing even one cycle significantly reduces your survival probability. You're already at increased risk. We discussed this. I know. But it's Jessica's wedding. Her only wedding. It better be her only wedding, Dr. Reeves said sharply, because you might not survive to see a second one if you compromise your treatment. She made a note in my chart. I saw her type something, hesitate, then type more. I'm documenting this conversation. Your family's interference with your treatment is medically concerning. 2 weeks before the wedding, Mom called with the schedule. The ceremony starts at 4. Photos until 6. Reception at 7. You'll need to be there by 3 for hair and makeup. Mom, my chemo is at 10 that morning. It takes 4 hours plus observation time. I won't be done until 4 at the earliest and I'll be sick. Can't you just leave early? Tell them you have somewhere to be. I'll have chemotherapy drugs in my 4. I can't just unplug and leave. You're being difficult on purpose. Her voice hardened. This is your sister's day, Natalie. One day. Surely you can manage one day without making it about your minor procedure. Minor procedure. Stage 3 cancer. 6 rounds of poison pumped into my veins. Surgery to remove my ovaries, fallopian tubes and omentum. But it was minor. What did Dr. Reeves say? Mom asked. Did you ask her about rescheduling? I had asked. Dr. Reeves had been horrified. Absolutely not. Your treatment schedule is calculated for maximum efficacy. Delaying even by days could allow resistant cells to proliferate. But I told Mom. She said she'd see what she could do. Another lie. I was getting good at them. Jessica called the next day. Mom said you're still being weird about the wedding. Nat, seriously? It's one afternoon. Can't you just take some Tylenol and power through? It's chemotherapy, Jess. Not a headache. Whatever. You know what I mean. Just, don't ruin this for me, okay? I've waited my whole life for this day. She hung up. I sat in my apartment, the one I could barely afford on disability payments, and cried until I vomited. Which might have been the chemo. Or the stress. With cancer, everything blurred together. The morning of June 15th arrived. I reported to the infusion center at Valley Hospital at 10 a.m. The nurse accessed my port and started the pre-medications. Dr. Reeves appeared, unusual for a Saturday. How are you feeling? She asked. Like I'm about to miss my sister's wedding. You're exactly where you need to be. She squeezed my shoulder. Your life is more important than a party, Natalie. Even if your family can't see that. The chemotherapy drip started. Carboplatin first, platinum-based poison that would kill fast-growing cells. Hopefully more cancer than healthy tissue. My phone buzzed continuously. Mom asking where I was. Jessica demanding I call immediately. Dad saying I was being selfish. I turned it off. At 2 p.m. halfway through my infusion, the infusion center door opened. My entire family walked in. Mom, Dad, Jessica in her wedding dress, Ryan in his groomsman tux, and a man I didn't recognize in an expensive suit. There you are, Mom said, her voice tight. We need to leave. Now. I'm in the middle of chemotherapy. Well, pause it. The ceremony starts in 2 hours. Jessica's dress rustled as she moved closer. Nat, everyone's waiting. The photographer, the guests, everyone. You're my maid of honor. You have to be there. I have cancer. I have to be here. It's just one session, Dad said, using his administrator voice. You can catch up next week. That's not how it works. The man in the suit stepped forward. Miss Torres, I'm Michael's father, Dr. Raymond Chen. I'm chief of surgery at Metropolitan General. He smiled, practiced and professional. I understand you're having some treatment today, but surely your medical team can accommodate a family emergency? Cancer treatment isn't something you accommodate around, I said. I've been a surgeon for 30 years. I think I understand medical priorities. His tone was patronizing. And I can tell you that family obligations, especially something as important as your sister's wedding, sometimes take precedence. It's about balance. Balance. I looked at my family. All dressed up, impatient, treating my chemotherapy like an inconvenient errand. I have stage 3 ovarian cancer. If I miss this treatment, my survival rate drops. But you want me to skip it for wedding photos. Don't be dramatic, Mom snapped. One session won't kill you. Actually, a voice said from the doorway, it might. Dr. Reeves entered and she wasn't alone. Behind her were 2 other people, a woman in a dark suit and a man with a hospital ID badge that read, Dr. Kenneth Walsh, Chief Medical Officer, Valley Hospital. I'm sorry, Dr. Reeves said, though her tone suggested she wasn't sorry at all. Were you about to interrupt my patient's cancer treatment to attend a social event? This is a family matter, Dad said quickly. This is a medical matter, Dr. Walsh countered. He was tall, gray-haired, and his expression could have frozen fire. And you are? Thomas Torres. I'm the hospital administrator. This is my daughter. Receiving chemotherapy for advanced ovarian cancer. Dr. Walsh looked at Mom. And you are? Elena Torres. I'm a nurse here. And Natalie's mother. A nurse. Dr. Walsh's eyebrows rose. A medical professional who understands that interrupting chemotherapy for a wedding is medically inappropriate and potentially life-threatening? Mom's face flushed. It's just one session. She can make it up. There is no making it up, Dr. Reeves cut in. Natalie has high-grade serous carcinoma. Her treatment protocol is time-sensitive. Every session is calculated to maintain therapeutic drug levels and prevent tumor progression. Missing even one cycle increases her risk of recurrence and death. Surely there's some flexibility, Dr. Chen started. There is no flexibility with cancer, Dr. Reeves said flatly. Dr. Chen, you're a surgeon. Would you stop halfway through a procedure to attend a wedding? That's not the same thing. It's exactly the same thing. Natalie's life depends on completing this treatment. Today. On schedule. Dr. Reeves pulled out her tablet. Would you like to see her scans? Her tumor markers? The surgical pathology showing lymph node involvement. She turned the screen toward the group. I couldn't see what she was showing them, but I heard Jessica's sharp intake of breath. This is what stage 3 ovarian cancer looks like, Dr. Reeves said, her voice carrying the weight of clinical authority. This is what Natalie is fighting. And her family, including 2 medical professionals, is trying to convince her to interrupt treatment for a party. It's not a party, Jessica protested. It's my wedding. It's a party, Dr. Reeves corrected. An expensive, elaborate party. And you're asking your sister to risk her life to attend it. The woman in the dark suit stepped forward. I'm Margaret Lawson, Hospital Ethics Liaison. Dr. Walsh asked me to observe this situation. He looked at my parents. Mr. Torres, Mrs. Torres, are you aware that pressuring a patient to refuse or delay recommended cancer treatment could be considered medical coercion? We're not coercing anyone, Dad said quickly. We're just asking. You told your daughter that missing one chemotherapy session won't make a difference, Margaret said. Mrs. Torres, as a nurse, you know that's false. You provided medically incorrect information to influence your daughter's treatment decision. Mom went pale. I didn't mean. You told her it was a minor procedure, Dr. Walsh added, reading from a tablet. You minimized her stage 3 cancer diagnosis to other family members as some medical issues. You scheduled a major family event during her treatment and then showed up at the hospital to physically remove her from active chemotherapy. He looked at Dr. Chen. And you, as a physician, just told a cancer patient that family obligations take precedence over treatment. In front of witnesses. In a hospital where you have no privileges. Dr. Chen's confident smile faltered. I was trying to help. You were enabling medical neglect, Dr. Walsh said. All of you were. The room went silent except for the beeping of my 4-pump. Jessica's face had gone from flushed to ashen. Ryan stood by the door looking like he wanted to disappear. Natalie has been undergoing treatment for 4 months, Dr. Reeves said, her voice quieter now but no less fierce. During that time her family has minimized her diagnosis, called her dramatic for experiencing side effects, and pressured her to prioritize social events over her health. Today they brought a wedding party into an infusion center to guilt her into abandoning treatment. She turned to face my parents directly. Mrs. Torres, you're a nurse. You took an oath to do no harm. How is pressuring your daughter to skip chemotherapy consistent with that oath? She's my daughter. I know what's best for her. She's your patient's age, Dr. Reeves interrupted. If any other patient's family was pressuring them to skip cancer treatment, what would you do? Mom had no answer. Dr. Walsh pulled out his phone. Mrs. Torres, as a hospital administrator and a medical professional yourself, Mr. Torres, you should know that what happened here today constitutes a serious ethical violation. I'll be reporting this to the medical board. What? No, Dad started. You used your position as hospital administrator to attempt to interfere with patient care, Dr. Walsh continued. Your wife, as a nurse, provided medically false information to influence treatment decisions. Both of you showed up at the hospital to physically remove a patient from active chemotherapy. That's not a family matter. That's a case study in how medical professionals can abuse their knowledge and authority. Margaret added, the ethics committee will need to review both of your professional conduct. Mrs. Torres, your nursing license will be flagged for investigation. Mr. Torres, your administrative role here will be suspended pending review. You can't do this, Jessica said, her voice rising. Over a wedding? You're destroying their careers over a wedding. We're protecting a patient, Dr. Walsh said. Your sister has cancer. She's fighting for her life. And her family, the people who should be supporting her, has spent 4 months telling her it doesn't matter. He looked at me. Natalie, I apologize on behalf of this hospital. You deserved better care from your family and better protection from us. We should have intervened sooner. Dr. Reeves took my hand. How are you feeling? Any nausea? I'm okay, I whispered. Good. Let's finish this treatment. Everyone else needs to leave. Now. My family filed out slowly. Jessica was crying, her perfect makeup running. Mom looked stricken. Dad was already on his phone, probably calling a lawyer. Dr. Chen left without a word, his earlier confidence completely gone. Ryan paused at the door. Nat, I'm sorry. I should have said something sooner. Done something. It's okay, I said. It's not okay. None of this is okay. He squeezed my shoulder. I'm staying. I'll wait until you're done, then drive you home. He did. While my family went to the wedding without me, Ryan sat in the waiting room reading magazines and checking on me every hour. When my infusion finished at 6 p.m., he drove me home, helped me to my couch, and ordered soup from my favorite restaurant. Mom's calling non-stop, he said, glancing at his phone. Saying you ruined Jessica's day. That she'll never forgive you. I know. You didn't ruin anything. You saved your life. He sat beside me. They're the ones who should be asking forgiveness. The hospital's ethics investigation took 6 weeks. They reviewed my complete medical history and interviewed Dr. Reeves, Dr. Walsh, and several infusion nurses who'd witnessed my family's behavior over months. They found that Mom had repeatedly minimized my diagnosis to colleagues, had discouraged other nurses from enabling my drama, and had provided medically false information about cancer treatment flexibility. Dad's administrative role had allowed him to access my medical records without authorization. He'd been checking my treatment schedule to plan around it, proving the wedding date was deliberately chosen to conflict with my chemo. Mom's nursing license was suspended for 6 months pending ethics retraining. Dad was asked to resign his administrative position. The medical board sent a formal letter to Dr. Chen expressing concern about his comments regarding cancer treatment prioritization. Jessica never spoke to me again. She blamed me for ruining her wedding, though she'd gone through with it and by all accounts had a beautiful ceremony. Mom and Dad sent one email saying I'd destroyed their careers over family drama. But Dr. Reeves stayed with me through all 6 rounds of chemotherapy. Dr. Walsh personally checked on me after my surgery. Ryan became my primary support system, attending appointments and helping me through the worst days. I finished treatment in September. My scans showed no evidence of disease. The cancer was gone, at least for now. I keep the wedding invitation on my refrigerator. June 15th. The day I chose my life over my family's approval. The day medical professionals stood up and said what my own relatives wouldn't. That my life mattered more than a party. The medical board's report is public record. So is Mom's license suspension. So is the truth that 2 medical professionals prioritized a wedding over their daughter's cancer treatment. They may never forgive me for not skipping chemotherapy. But every day I'm alive is a day I chose survival over their expectations. And that choice, Dr. Reeves tells me, is the reason I'm still here to make any choices at all.